Did you know that some of the deadliest infections can sneak into our bodies without us even realizing it? From life-threatening bacteria to silent viruses, these unseen enemies can cause severe damage if we're not careful. In today's video, we're going to explore the most dangerous infections known to humankind and discover how they spread, what symptoms to watch for, and how to stay safe. Each infection we cover has a unique story, often with surprising origins and shocking consequences. Some may come from the food we eat, others from a simple cut or scrape, and a few from something as ordinary as a cough. So, if you're curious about the hidden threats that could be lurking in everyday life, keep watching. This is every deadliest infection explained. Let's dive in. Botulism is one of the most deadly infections, caused by a potent neurotoxin produced by Clostridium botulinum. This toxin can be found in improperly canned or processed foods, making it crucial to follow proper food safety guidelines. When ingested, the toxin blocks the transmission of nerve signals, leading to muscle paralysis. Initial symptoms can occur within 12 to 36 hours after eating contaminated food, including double or blurred vision, drooping eyelids, and difficulty speaking or swallowing. As the toxin spreads, it can cause respiratory failure, requiring immediate medical intervention. Botulism is a medical emergency, and early treatment with antitoxins can be life-saving. In addition to foodborne botulism, there's also infant botulism, which can occur when infants consume contaminated honey, and wound botulism, resulting from contaminated wounds. The best way to prevent botulism is to ensure safe food handling and avoid feeding honey to infants under 1 year old. It's a reminder that even the food on our shelves can hide hidden dangers. Gas gangrene is a fast-spreading and often fatal infection caused by Clostridium perfringens, a type of bacteria commonly found in soil. It enters the body through deep wounds, like those from traumatic injuries or surgery, and can lead to tissue death within hours. The infection starts with intense pain and swelling around the wound. As it progresses, the affected area may turn red, bronze, or purple, with gas-filled blisters forming under the skin. The gas produced by the bacteria creates a distinct foul odor. If not treated quickly, gas gangrene can spread rapidly, leading to shock, organ failure, and death. Treatment often involves aggressive surgery to remove dead tissue or amputation to prevent further spread. Antibiotics are also used, but because the infection spreads so quickly, early diagnosis and treatment are critical. This deadly infection is a stark reminder of the importance of proper cleaning and caring for wounds, especially those exposed to dirt or contaminated materials. Whooping cough, also known as pertussis, is a highly contagious respiratory infection caused by Bordetella pertussis. It spreads through respiratory droplets from coughs and sneezes, making it easy to catch in crowded settings like schools and public transportation. The hallmark symptom of whooping cough is severe, coughing fits that can last for weeks. These fits are often followed by a whoop sound, as the person gasps for air, giving the infection its name. In severe cases, the coughing can be so intense that it leads to vomiting, rib fractures, or even breathing difficulties, especially in infants. Vaccination is the most effective way to prevent whooping cough. The DTaP vaccine is recommended for children, while adults should receive booster shots to maintain immunity. Treatment typically involves antibiotics, but early diagnosis is crucial to limit the spread of the infection. Whooping cough is a reminder that even a simple cough can indicate a serious infection, emphasizing the importance of vaccinations and good respiratory hygiene to protect ourselves and those around us. Chlamydia infection, caused by Chlamydia trachomatis, is one of the most common sexually transmitted infections, STIs, worldwide. It often spreads through unprotected sex with multiple partners, making it a significant concern for sexually active individuals. Chlamydia can be a silent infection, with many people showing no symptoms. However, when symptoms do occur, they can include painful urination, abnormal discharge, and pelvic pain in women. If left untreated, chlamydia can lead to severe complications like pelvic inflammatory disease, PID, and infertility in women, and inflammation of the urethra and testicles in men. The good news is that chlamydia is treatable with antibiotics. Early detection is key to preventing complications, so regular STI screenings are crucial for those at risk. Practicing safe sex by using condoms and reducing the number of sexual partners can significantly lower the risk of infection. Chlamydia infection highlights the importance of sexual health awareness and open communication with partners. By being proactive and taking preventive measures, you can protect yourself and others from this common yet potentially serious infection. Streptococcal infections are caused by Streptococcus bacteria, which can lead to a range of illnesses, from mild to severe. The most common types of streptococcal infections are strep throat and tonsillitis, which are familiar to many from childhood. These infections are highly contagious, spreading through respiratory droplets from coughs and sneezes, as well as through shared food or drinks. While strep throat usually resolves with antibiotics, complications can arise. In some cases, the body's immune response to the infection can lead to rheumatic fever, which can damage the heart valves, causing long-term health issues. Symptoms of streptococcal infections include sore throat, fever, swollen lymph nodes, and white patches on the tonsils. Treatment typically involves a course of antibiotics, and it's crucial to complete the entire course to prevent antibiotic resistance. Prevention is largely about good hygiene, washing hands regularly, avoiding close contact with infected individuals, and not sharing eating utensils. Streptococcal infections are common, but with proper care and treatment, they can be managed effectively. Tetanus is a serious infection caused by Clostridium tetani, a bacterium found in soil and animal waste. It enters the body through deep cuts or puncture wounds, where it produces a toxin that attacks the nervous system. This toxin causes severe muscle spasms and stiffness, commonly starting with lockjaw, where the jaw muscles clamp shut, making it difficult to eat or speak. Without treatment, tetanus can lead to muscle rigidity, painful spasms, and even death due to respiratory failure. The best prevention is vaccination, with booster shots recommended every 10 years. If an injury occurs, prompt wound cleaning and medical attention are crucial to prevent tetanus. Legionnaire's disease is a severe form of pneumonia caused by Legionella pneumophila, a bacterium found in water systems like cooling towers, hot tubs, and air conditioning units. It spreads through inhalation of contaminated water droplets, often affecting older adults or those with weakened immune systems. Symptoms include high fever, cough, muscle aches, and respiratory distress, typically appearing 2 to 10 days after exposure. Treatment requires antibiotics, and severe cases may need hospitalization. Proper maintenance and cleaning of water systems are key to preventing Legionnaire's disease. Leprosy, also known as Hansen's disease, is caused by Mycobacterium leprae, a slow-growing bacterium that primarily affects the skin, nerves, and mucous membranes. It spreads through prolonged close contact with an infected person, typically through respiratory droplets. Symptoms include skin lesions, numbness, and muscle weakness. If left untreated, it can lead to severe disfigurement and nerve damage. The good news is that leprosy is curable with multi-drug therapy if diagnosed early. Early detection and treatment are crucial to prevent permanent nerve damage and disfigurement. Gardnerella vaginalis infection, also known as bacterial vaginosis (BV), is caused by an imbalance of vaginal bacteria, leading to a decrease in beneficial bacteria and an overgrowth of harmful bacteria. It's common among women and can be triggered by factors like dosing, multiple sexual partners, or hormonal changes. Symptoms include a fishy odor, abnormal discharge, and vaginal discomfort. Treatment typically involves antibiotics, and prevention includes avoiding douching, practicing safe sex, and maintaining proper vaginal hygiene. Early diagnosis and treatment help prevent complications and recurrence. Tuberculosis, TB, is a contagious infection caused by Mycobacterium tuberculosis, primarily affecting the lungs. It spreads through the air when an infected person coughs, sneezes, or talks. Symptoms of active TB include a persistent cough, chest pain, weight loss, and night sweats. Latent TB may not show symptoms, but can reactivate if the immune system weakens. Treatment for active TB requires a long course of antibiotics, while latent TB is treated to prevent future activation. Early detection, regular screenings, and complete treatment are crucial in controlling the spread of TB.